Hello everyone, I am Sharvari Pandit. I am a dermatologist. I am practicing at Pandit Clinic, which is based in Pune. This is DermaVidya. This is a web platform. It is meant for dermatologists and their patients. Today, I shall be talking to you about the hyperpigmentation disorders. This video shall give you some insights into the problems of hyperpigmentation and their possible treatment solutions. Almost everybody of us has some or the other pigmentation issue. It could be a little or it could be too much. So basically what happens is there are certain areas of skin where the pigmentation, the color of the skin changes. It becomes darker than the surrounding areas. This is called as hyperpigmentation. It basically happens because of increase in the melanin content of that particular area of skin. So hyper is called excess. So it is excess pigmentation. One of the major causes of hyperpigmentation is sun exposure. Whenever we observe, there are certain areas of our body which are covered, like your chest, like your thighs, abdomen. It is much lighter in color, and certain areas of your body, like your arms, like your face and neck, it is a little darker in color. That is hyperpigmentation, which is because of constant sun exposure over the years. The UV rays from the sunlight stimulate melanin production and thus darkening of skin. The sunspots, the age spots, and also melasma sometimes increases, worsens because of sun exposure. The type of hyperpigmentation, that is melasma, is many a times triggered by hormonal changes. Pregnancy, use of oral contraceptive pills, abortions can sometimes trigger melasma, suggesting its hormonal nature. A menopause also can sometimes trigger melasma. Another condition is called PIH. PIH is post-inflammatory hyperpigmentation. Whenever we get hurt, so there is some trauma, there is burn, there is any cut injury, there is healing of skin. So when the skin heals, there is sometimes excessive melanin production which causes pigmentation in the specifically healed areas. This is called as PIH or post-inflammatory hyperpigmentation. There are certain medications such as minocycline. They can cause overpigmentation because of exposure to sunlight. There are certain differences which you can see clinically. So a melasma is always like a patch. So it can come like a butterfly patch. It can come on your cheeks, the nose, foreheads. A sunspot is generally scattered. So you might have multiple sunspots which could be scattered in these areas. They can also be present on other areas of sun exposure. So you can get them on your hands. You can get them on your decollete areas. A PIH, a post-inflammatory hyperpigmentation, is classically seen only at the site of trauma. In many cases, even acne can cause post-inflammatory hyperpigmentation. A good diagnosis of a specific hyperpigmentation, its causes and treatment can be done by your dermatologist. So preventing hyperpigmentation is the key, and sun protection is the major factor that can really prevent hyperpigmentation. Once the hyperpigmentation forms, it is difficult to treat, but preventing it early is quite possible. A good sun protection is always mandatory. It should be used throughout the day, even sometimes while indoors. If your surroundings are very bright, if there is a lot of reflected sunlight inside your cabin, if you are in front of your PCs all the time, if you are using your phones too much, it is mandatory to use sun protection, a good sunscreen even while indoors. Whenever you are outdoors, a good protective clothing, hats, caps, jackets also should be helpful. You can incorporate products containing niacinamide or vitamin C or antioxidant in your daycare routines to prevent hyperpigmentation. When it comes to treatments, there are a lot of options available. There are certain creams like hydroquinone, kojic acid, azelaic acid that can be used topically to treat pigmentation. There are certain treatments like chemical exfoliation, so a chemical peel. There are certain lasers like a Q-switch NDAG laser that can treat your pigmentation. Also a treatment called as microdermabrasion can exfoliate your skin mechanically, and it can give you a lot of improvement in the pigmentation. There are various sophisticated treatments. They are called as high-end peels or deep peels, such as a cosmelan peel or a dermamelan peel. In a lot of resistant cases of pigmentation, such peels can be opted for. If someone is wanting to try something at home, something that contains a green tea extract or something that contains a licorice extract can be tried at home. The chances of improvement are subtle, but it can be definitely tried without much harm. Vitamin C works as an antioxidant and depigmenting agent. Do not use harsh chemicals on your skin. It can trigger your pigmentation. So hearing success stories about pigmentations is very cheerful. Treating hyperpigmentation is very, very difficult. You need to be very patient. So a lot of times you have to listen to good reviews. There are certain patients who have had their great treatments. They've been patient with their treatments and they've had great results. So you have to be very, very patient with your treatment. Carry it on for a long period of time. Stay updated with all the newest, latest treatment possibilities. Consult your dermatologist whenever you want to have a new treatment done for yourself. Whether you're wanting a basic skincare routine or you're wanting to go for an advanced treatment, your dermatologist and DermaVidya both will be there to help you out with all your treatment journeys. I hope this video has been useful. If you like the video, if you wish to watch more such videos, visit dermavidya.com and enlighten yourself. Thank you for watching. Take care of your skin.
For more such videos, visit or log into dermavidya.com.